Hello, everybody. My name is Saleem Islam, and I am the chair of surgery and also a pediatric surgeon here at Aga Khan University. We recently had the opportunity to take care of a child with a very rare condition. His name was Ayan. Ayan को एक बीमारी थी जिसको हम CPVT कहते हैं, and that is a ventricular tachycardia, एक arrhythmia होता है जो कि congenital होता है, and that is a genetic problem. And उसकी वजह से he basically kept getting what's called ventricular fibrillation, which is a essentially fatal arrhythmia. Our colleagues at NICVD, National Institute of Cardiovascular Diseases, who have expertise in pediatric electrophysiology, actually took care of him by implanting an automatic implantable defibrillator, cardiac defibrillator. और इस डिवाइस ने उसकी जान तो बचा ली, but it kept shocking him. And so everybody knew, Dr. Mohsin, our colleague over there, knew that this was probably not a long-term solution. He asked us to get involved to help with what's called a Left Cardiac Sympathetic Denervation, LCSD, a very rare procedure which is done in very few centers in the United States or Canada, and certainly to our knowledge has not been done in Pakistan to date. तो हमने काफ़ी आपस में डिस्कशन भी की, एनेस्थीसिया वालों से, आईसीयू वालों से भी बात की, फिर अमेरिका में भी जो सेंटर्स हैं जो कि इसको करते हैं उनसे भी बात की और टिप्स लिए. And then we decided that as there was really no other option for this child and this family who had already lost 4 children to this same disease, that we wanted to go ahead and offer this to them. I think we also have to salute the family's bravery, that they, understanding fully that we had never done this before, that they wished to connect with us and go ahead with this on this journey. So, वक्त आया, हम अयान को हमने admit किया, and then we brought him to the OR where the anesthesia team delivered a superb anesthetic pre-op and post-op as well. The operation itself, by the grace of God, went very well. It took us about 21 minutes. The operation was done thoracoscopically, which means that the biggest incision was 5 millimeters, जो कि बहुत छोटा होता है. उस 5 millimeter incision में हमने कैमरा डाला था. बाकी जो incisions थे हमने 2 और लगाए थे, उनमें हमने अपने आलात डाले थे, instruments रखे थे, and we operated off a TV screen. वो incisions 3 millimeters के थे सिर्फ. Through these incisions, we were able to identify the sympathetic chain on the left side, count the number of ribs, start from the 4th or the 5th rib, usko humne alayda kiya, divide kiya, and then we sequentially went up each level, dividing each level as we went until we got to the top, which is at the T1 level, jisko hum stellate ganglion kehte hain. A ganglion is a connection of nerves. उन nerves को मिला के that controls a lot of things. That is the autonomic nervous system, जो कि हमारे सोच के बगैर चल रहा होता है, automatically in the background. उसका हमने lower third को हमने काट के निकाला और साथ में 5 levels को भी निकाल डाला. And after that, we turned his device back on, anesthesia वालों ने उसको जगाया, we sent him to the ICU where he spent the night, and then he actually went home the next day. So that was through the fact that we did it in a very minimally invasive fashion. But I think it's important to understand that this case illustrates more than just a success in a single patient. It allows us to offer a technique, a treatment where none existed. It also shows the power of institutions and people coming together to remove egos, to remove everything that comes in between us, and to just strive for a common goal, which is the treatment of a patient, and hopefully patients, plural, in the future. हमारा इरादा तो ये है कि this procedure, the technique that we've used from an anesthesia perspective, from a surgical perspective, from a cardiac electrophysiology perspective, we push this out and we teach anyone who's willing to learn and wants to learn this so that we can offer this to more patients and more institutions across the country. Our goal is to help as many patients as possible with as many means as possible. And one thing that makes us all take care of more patients is to come together and to do it in a way in which the patient remains at the center of everything.